I wasn't sure it was my name that was being pronounced, but before I start talking, I want to ask everybody to stand up and stretch. Including the adolescents. Okay. Thank you. Okay. Well, this is important because we just had lunch and we've been sitting for over an hour. And we are talking about health and trying to make things different. So please have a seat. Well, first, let me thank, I think I need to get this out of the way. To the laptops? Wow. I thought you learn everything every day. Now I have to point to the laptop. It has to be turned on. You learn things every day. Please, the presentation I'm going to be making is for 3 categories of people. The adolescents and youths that are sitting here is for you. The PhD and postdoctoral scholars that are here is for them. I'm hoping that a few of the senior people will also pick a couple of things in it that may be useful. But coming to talk after, I got it now. After the keynote speaker, and especially the things he said, all the information you had this morning, I'm going to be repeating them. That's why I'm directing it to the adolescent and youth, because what I put together is to go through a few things, but the most important part of it is the missing link. I also want to bring back some information that we don't often talk about. And this part is for PhD and postdoctoral scholars. Because if I continue to talk and I run out of time and the MC told me to get out, I won't have a chance to acknowledge those work that I'm using. Always bear in mind, because as I sit here, I borrow a lot of the information from these people, and I want to acknowledge them, their work that make it possible to make this presentation. So that's lesson number 1. Now, I'm not sure how many have seen the pictures in the top of the slide, because for the past 4 decades, advances in science, innovation, best practices, innovative interventions have changed everything about life. You can argue what role genome sequencing played in those innovations. Sequencing the genome of human takes us to a new level to understand what life is about. Sequencing the mosquito that transmit malaria, that kill the pregnant women, children, made a big difference. Sequencing the parasite and moving those things into innovative interventions have changed things. They are commendable achievements in life. But I need to remind you, today, maternal mortality has gone down. Even in Africa, in Nigeria, where you see the red color, it has gone down. The sadness of a mother dying is from innovation, best practices, and everything. More important, infant mortality is also gone down. We now have vaccines, interventions, and practices that make it easier to generate and make things. But the one that is also missing is that longevity is now what everybody talks about. Even in Africa, people are living. When I was in school, the life expectancy for an African was 47 years. Today, if you are 70-year-old, you cannot make claim because you have 85-year-old people sitting and they are elder. Today, the Vice Chancellor of Cape Town University, University of Cape Town, is a young man. And we have to recognize that as one of those people who have benefited from sciences. This essentially is what everybody is patting their backs on the SDGs. We now talk about life is good, all is well in human life. But that's not true. There are great achievements. We've moved forward. The success is phenomenal. But there is a missing link. Why are these missing links important? That's what this presentation is about. These people that you see here wearing inverted t-shirts that says they're doing good. They're doing good, but not well. We need to know why, because there's over 1.8 billion of their people across the globe. Interestingly, 90% of them live in low middle income class, a phenomenon that refers to Africa, Southeast Asia, and poor countries in Latin America. That's us. To make it worse, over 1 million of them die every year. It's the sadness for the family, but not only that, it's a gap for the future of our communities. What will make it worse? What they die from are things that you don't even want to talk about. Because most of the cause of death, road accident, HIV, AIDS, they are preventable causes that if we know how to prevent it, we can reduce those deaths among them. The question is, do we know much about it? And why is it necessary? This population will continue to grow, outnumber every other demographic group in life. Most important, the largest growing adolescent and youth population are from Africa, and it will continue. That's a large number of people to deal with. This is the progression for 2060. I won't be here, but they will be here to see it. But the challenge they face is interesting. The AMSI program talk about nutrition and providing food. Nigeria has the largest school lunch program. The reason for giving it is not just for nutrition. It's also to keep the students in school. As the last presenter presented, the large number drop out of grade 4. In Nigeria, over 40% are out of school. These are people who will grow up to run the country. The reason we talk about it is selfish. Mr. Stanley talked about when he grows up, nursing home, geriatric home will not be available if these people don't go to school. That's a selfish reason I share with you. But that's not the only reason why we need to look at them. There should be no circumstances where you were born should determine your fate in life. In low-middle income country, the address determines what happened to adolescents and youth girls. Living in rural area means you get pregnant early. 52% of rural girls are married compared to 12% in the urban area. Why? Because they were born in rural areas. More important, 25% of them have their children by age 18. It's what I call baby making babies. They used to have a song in the US that's a baby making baby. It was a very interesting thing. Now, what happened to the mother that didn't know anything about a child? But we know so much. Professor Yemani and the group identified the risk factors in 5 health domains that we know do affect and have impact on the future of the adolescent. The question we're asking is, can we use our assets, our knowledge effectively to drive the outcomes of the adolescent life? We don't have to have phenomenal riches to protect them. As Mr. Stanley mentioned the other time, when you talk about food nutrition, you are talking about water, land, and the ability to grow and do it. All the other things we talk about, transportation, all the line and all that, they are interesting. But we cannot claim because we do not have resources that the adolescents will not be taken care of. Because if we don't, we will see the repercussion not only in them, but in the future generations. UNICEF and other studies have shown the value. This is the rationale behind ARISE proposing to have the think tank on adolescent and youth health. We have heroic leaders who are making impact by advocating. We need to talk to the next level where we provide evidence, rationale, proof of principle. There are decision makers, our private sector, our rich people can use to address it. So in this talk, I'm talking about creation of this, which we launched this morning. I'm talking about it as an after effect after launching it. Our think tank is going to focus on 3 domains: nutrition and physical activity, sexual and reproductive health. Girls at 18 don't get pregnant by themselves. So the focus is not just on the girls. The focus also has to be on those who get them pregnant. The focus also has to be on the rationale why they have access and the liberty to become there. But more important also is mental health. So the question we are asking, because now on the African continent, you have over 1,000 universities, colleges of education, nursing school, and everything. And one of our vice chancellors is here. Can we have a platform that uses the knowledge of these people living in Ivy League to help decision makers like the minister to chart the path where they can use the resources effectively and have impact? This is the rationale behind the proposition to have the think tank. We are not doing it without having foundation. The former Director General of WHO and former Prime Minister of Norway articulated that good science is the basis of good public health. But the challenge we face is to translate best sciences into public policy. 10 years of ARISE means we have leadership, we have knowledge that can take good science and try to translate it to good public health. So our idea is that we will use this think tank to translate research and innovation to foster policy imperatives, which is the hard work, to convince policymakers, private sector individuals. And this is why I'm saying, when we direct this to the adolescent, we will need you to speak. You may not know what you are going through or what the future means, but we will be able to carry you, open the door, so that you can talk through it. Why do we need to do this? There are 3 dividends to investing in adolescent girls especially. You can change their life now, as UNICEF has indicated to us. But more important, you change their future. What they learn as adolescents will drive what they do. but critically for the generation itself, is that the children that they have should grow up benefiting from the experience that they gain. And there is evidence, Sheehan, for every dollar invested in adolescents, there are a tenfold return in social as well as economic benefits of the investment in them. So why can't we do that? If we invest what we have, which is Miaga, and we are getting tenfold, it's like winning a lottery. So our proposition is to have this business card for the think tank leaders. And we are presenting this so that you can all look at it and make input, send suggestions to us to make it better, so that we can collectively own the output. We are creating special thematic working group on the 3 domains. They will be hosted in Uganda, Ghana, and if the Vice Chancellor agrees, in South Africa. The idea is for them to be the driving engine, for us to understand our custom, the norms, the challenges our adolescents face. For them to look at what innovations are available, what can we put together to make a difference. Because right there on the left, if they push reports to us, then we can take it to stakeholders, including adolescents, private sector, company owners, and those who are advocating will be part of us. Eventually, what we would like to have will be concrete policy briefs that has evidence, has strategy. We are not going to make policy, but we will have to put on the table policy options that ministers can look at and use. But we need to bear in mind, if you give a minister a policy option that is not based on the asset they have, they will not use it. If the minister picks your option and it does not drive impact, the Prime Minister or the President will remove that minister. So our think tank leaders, what we will look for from you and your help on is to guide us so that the policy options and strategies that are coming out of this think tank are asset-based, impact-driven. That is the only way we can assure the sustainability, because we need to look at the uptake and see what impact we have on the adolescent. We also want this so that when they see it themselves, they will have a better roadmap for future of those who are coming behind them. This is the rationale for us. All we are looking for is to align the needs and assets to generate policy options that are useful and to demonstrate to our government, our leaders, our partners, that those options are effective and they can make a change. We see smile on their face, but a lot of those smiles are temporary in some cases. We want everlasting smile on their faces so that they can look forward to one. All of this is not that we have money. Professor Wofai, who created the Arise, didn't have the money to put all of this in place. But we still, and I used to call her Dr. Mary, but now she's Elder Mary. The group have been able to go, and all the leaders of Arise, and be able to convince the European Commission, the Ministry of Research and Education of Germany, and GIC to support this idea. But it's a 5-year program, which means deliverables must be in place if we want to continue to help to meet the needs of our people. We are benefiting from leaders who have accepted, 8 of them, to run the think tank as leaders for us. 4 of them are here today. You've met them. They will also introduce them to you. They are selected from countries across Africa, so that if you have ideas, you can send it to them, and especially adolescents, you can be in touch with them. This has been an excellent one, and I thank you all for accepting to lead our think tank and to help us to make it move. The selection process to reach where we have them was not easy. There's a group that we call the Policy Imperative Working Group, led by Elder Mary, coordinated by Dr. Joy, who's been running around, Dr. Nwasi from South Africa is a coordinator, Professor Angela. Over the 1 year, they went through. So if you don't like who they selected on the think tank, it's from them, not me, including Amani. I'm just the one convening the message of what they put together. I'd like to thank you all for your effort into making this possible, the PRWG and the think tank people. And to all the audience, this is how the youths say thank you.